An EKG, or electrocardiogram, is a test that measures the electrical signals of the heart to detect irregular rhythms, signs of heart damage, or other heart-related conditions. The most commonly used version is called a 12-lead EKG, which provides 12 different views of the heart's activity using only 10 electrodes. 4 electrodes are placed on the limbs, and 6 are placed on the chest. These combined positions allow the machine to generate 12 leads or viewpoints, giving a complete picture of how the heart is functioning. The patient should lie flat on their back in a supine position during the test. If they have difficulty breathing in this position, they can be slightly elevated or seated upright. It's important to instruct the patient to remain still and avoid talking or moving to prevent interference with the tracing. For the limb electrodes, the white wire labeled RA is placed on the right arm, the black wire labeled LA is placed on the left arm, the red wire labeled LL goes on the left leg, and the green wire labeled RL is attached to the right leg. These wires are essential for producing the limb and augmented leads. The chest electrodes are placed in specific locations across the front and side of the chest. V1 is positioned in the fourth intercostal space on the right side of the sternum. V2 is placed at the same level on the left side of the sternum. V4 is located in the fifth intercostal space along the midclavicular line on the left side. V3 is placed between V2 and V4 and is applied after V4. V5 is placed horizontally in line with V4, near the front side of the body at the anterior axillary line. V6 is also aligned with V4 and V5, but is placed further to the side along the mid-axillary line. Make sure all electrodes are applied to clean, dry skin and avoid areas with lotions, oils, or powders, as these can interfere with signal quality. It's important to note that the arm electrodes have their tabs pointing downward, the leg electrodes have their tabs pointing upward, and the chest electrodes also have their tabs pointing downward. During the procedure, unwanted signals called artifacts can show up on the EKG tracing. These include wandering baseline, which appears as drifting lines caused by poor skin contact or oily skin. Interrupted baseline is seen as flat lines or breaks and usually results from a disconnected or damaged wire. Somatic tremor shows as sharp, erratic spikes caused by muscle movement, such as shivering or talking. AC interference appears as a series of uniform small spikes and is often caused by electrical devices nearby, like cell phones, fluorescent lights, or power cords. Recognizing and correcting these artifacts is important to ensure the results are accurate and reliable.